So first of all, I've worked with the AGA with a couple different companies, and I can tell you that we've always been pleased with the AGA's ability to give us really good insights into the marketplace, both what's going on today and what's going on in the future. So we've been able to use them as a partner, and we look at them as a partner to help us kind of understand the best path forward for our product lines and for where the customer is going.
Mm-hmm. And what about how you've worked with the AGA Center for GI Innovation and Technology?
Okay. So we actually have some history with the center. We view the center as a great forum for us to look at our products, look at kind of our strategies as a business, and be able to bounce those ideas off the thought leaders across the industry. The center actually uses both your current customers, but what's really good is they use customers that maybe haven't used your product before. And so you get a really good cross-functional or cross breadth of communication of people that allow you to kind of understand what your strategy looks like in their minds, and helps you either course correct or helps you confirm what you were thinking in terms of how to go forward.
So this gives you a real advantage in development.
It does, because it allows you, if you're going down a path and you get these experts in the room and they give you reasons why that path does not make sense, and you're going to end up taking a lot longer and spending more money and not necessarily meeting the customer's needs, it gives you a chance to course correct and be able to streamline that process and be able to move forward and to bring that value to the marketplace quicker. At EndoGastric Solutions, we've actually worked with the center twice. Once was several years ago, and then one was most recently this week at this AGA Tech Summit. So several years ago we came in and we showed the organization kind of what our thought process was and what our business plan was, and they were able to give us some really good insights that actually helped us. Instead of going down one path that would not have been most productive, we were actually able to course correct and be able to change the way we were going to approach our business planning. And quite frankly, 3 years later, we're now in a situation where we've actually hit a number of different clinical outcomes and proven that we have clinical data that actually makes sense for the marketplace, and actually helped us with our CPT efforts quite a bit.
How does the STAR Registry play into that?
Great question. So the STAR Registry, we're really excited about. The STAR Registry is an initiative with the AGA, and the registry is going to give us a chance to compare directly with the gold standard out there, which is Lap-Nissen. And so we'll have an opportunity to look at safety and efficacy with surgeons and GIs. We'll do 500 total patients, 250 will be with our TIF procedure, and 250 will be with the Lap-Nissen procedure. So we're going to be able to gain quite a bit of information relative to how does it perform, what's the durability, what's the efficacy of the product, and then also will give us some economic outcomes that we think will be very important to the payer community. So the AGA is really good to work with. The reasons I believe that's the case is, one, that it's a very diverse set of experts. If you look at their leadership team and what they bring to the industry side of it, they have experts in terms of healthcare economics, reimbursement, payer, coverage, etc. Guys like Joel Brill make a heck of a lot of difference for all of us on this side of the business. You also have a really, really diverse team that actually understands what the customer is looking for, and in this case the GI community. What do the physicians need, both in the academics as well as the community hospitals and offices, and they give us those insights. So you can actually connect the dots a lot easier, and you can actually make those improvements and enhancements as a company quicker to actually meet the needs of those that serve the GERD patients.